Today, you are here to hear about the state of practice. And we're going to be looking at academic year 2022 and 2023. My name is Jessica Chambliss, and I'm happy to have you with us. So what I want to start off by is just showing you all the layout of our presentation today. We'll talk about our staff, our mission and our goals, our applied practice experience, student engagement, workforce development, and communication initiatives. I want to start by saying that we have an amazing team with the Office of Public Health Practice, and I want to highlight them because I may stand up here as the face of the office, but we could not do anything without our team. So when I call your name, if you could just stand up, only because I just want to recognize you and applaud you for all you have done with us. So Dr. Lisa McCormick, Mallory Duff, Tessa Graham, Elena Kidd, Mina Nabavi, our staff. And Julie Rowe, I'm so sorry, Julie. Yes. And also we have some amazing graduate assistants that work with us as well. Riley and Sheriff are in the room. Would you all just show who you are? All right. So we'll start this off by looking at our mission and our goal. So the mission of the Office of Public Health Practice is to make a difference in communities by working with our public health stakeholders. And one thing that we try to do of who we are and what we do, if you look at that green box, we support applied and interdisciplinary pursuit of scholarship and public health practice through research, teaching, and in service, with the goal of promoting and enhancing the engagement between practice community and the School of Public Health faculty, staff, and alumni. So a lot of the metrics that we're going to talk about today are familiar to most of you, but I do want to highlight some things that we will discuss later on. What's new for OPHP? And it really falls in terms of our communication efforts within the school. And so one thing that we wanted to do, especially when we want to enhance and to address different changes within our office and within the school, we wanted to hear from our students. So we conducted some student focus groups to hear about communication within the school, especially geared towards our Getting a Handle newsletter. So I'll talk about that a little bit more later. So I want to start with our applied practice experience, and I'm going to spend a few moments talking about this objective in many different segments. So objective 1, promote and sustain opportunities that enhance the public health practice and service experience for our students. So our applied practice experience is really our internships. And so what we want to highlight for academic 2022 and 2023 is that we had a total of 224 MPH students and 11 DRPH students to complete their internship and practicum. And so when we look at that 235 students to your left over there, we see that there were mostly, we had, again, 224 public MPH students and 11 DRPH students. These students completed over 40,000 contact hours, and they had 178 unique placements. 16 of them were in local, federal, and state health departments. One thing that I also want to highlight from our amazing internship coordinators, they're responsible for completing orientation sessions, giving information to our students at the beginning about the applied practice experience. They're responsible for having one-on-one meetings with our students to discuss their internships, what they may be interested in, also looking in terms of how helping them find internships. Other things that they're responsible for is monitoring the progression of the students from beginning to end. And that sometimes requires some technical assistance when issues may arise with interns or preceptors or with organizations. They're responsible for managing that. They're also responsible for meeting with current and potential preceptors, because our goal is to expand the number of organizations that we work with. And so they're responsible for helping us with that, being a liaison with our community partners. And also they manage our APEX system. Our APEX system is where we house all of the information for our interns, where our students place their hours, their proposals, and so forth. They're responsible for managing that as well and providing technical assistance when needed. They're busy. So one thing we want to highlight here, this is similar to what we showed last year. It's just seeing where our students are placed by industry. What I want to highlight that we do have more students in the nonprofit and community-based organizations, and then we have an increase of students in health departments. One thing that we've been trying to do over the last few years is to get students to move outside of academia in a sense so they can go into the communities and work with people that are doing the work in communities. And so what we've seen that has gone down over this last year. Percent change has declined over the last year. And we're very excited to see the increase in students going into governmental public health internships. And one thing we want to highlight there is that last year, we had the opportunity to have a governmental public health internship stipend program where students who were interested in working in governmental public health at the state, local, and federal level, local, state, and federal level, we provided them with stipends in order to help them in a sense of an incentive for them to work in those areas. So we supported 11 students in academic year 2022-2023. We had 8 students who interned with the Alabama Department of Public Health. We had a student in Ohio in the city of Norwood Health Department. We had 1 student at Mobile County Health Department. That is where my home is. And then we had a student in Minnesota as well. And we're continuing to support students in this way. We're continually to highlight this program, and again, trying to have more relationships with our local, state, and state agencies in order to have them in a pathway and an ability for them to be able to host interns in those spaces. So this is not an exhaustive list of where our students were in the last academic year, but we wanted to highlight some of these organizations that had 2 or more students. And so again, we've had many different unique sites, but this is just an example of where our students intern. So looking over trends over the past couple of academic year, you can see where our students are interning by department. And this is similar to the enrollment numbers. And so as you can see for academic 2022-2023 is in that yellow. And you can see where they are based on their academic department, their concentration. So one thing that we are excited about and what we've realized is not all of our students are interning in the state of Alabama. We had 133 students at 57% to complete their practicum or internship in the state of Alabama, where we had 39%, 92 across the United States, and we had 10 to complete their applied practice experience in other organizations outside of the U.S. We had in those countries were India, Zambia, Kenya, Uganda, and Mexico. So what we see is that students are finding their internships from a number of ways. Majority of our students are coming through an employer or former employer of an organization that they're familiar with. But a lot of them are coming through the Office of Public Health Practice. Again, going back to where I said our students, our internship coordinators are meeting with our students one-on-one. And so they're responsible for helping, one of the responsibilities is helping them. Some of them are receiving through personal contact, then have other web search, faculty recommendations, and other student recommendations. What we're seeing that we have about 21% have compensated internships, paid internships. And what we're now seeing this shift to where a majority of our students are in a hybrid internship, so working remote and in person, and where we have an increase of 29 and we're seeing a 29% are remote. When we're asking students to evaluate their knowledge and the skills that they've gained over their time in their internship is very important for us to, we're aligning it to the competencies that are set up by our accreditation body. And so this is just a highlight of the top 5 competencies that our students have selected in terms of making the relationship between before and after, and where have they seen the increase of their confidence before and after their internship. So we can see with NPH 19, communicating with the audience, another one, 18, NPH 18, communicating, select communication strategies for different audiences. NPH 4, interpret results of data analysis for public health research, policy and practice. NPH 9, design and public health policy program, project or intervention. And NPH 2, select quantitative and qualitative data collection methods appropriate for a given public health context. So what you can see over time, prior to their internship, and you can see the change in their confidence after completing their internship. So we want to highlight what some of our students have said about their experiences during this year. And I'll go with Sean Thomas that said, this internship at the City of Detroit Mayor's office gave me a front row seat to how local government works and how priorities are quickly shift and how priorities can quickly shift, and above all, how public health servants really do what to serve the citizens. The internship provided me with great hard and soft skills that are transferable to any opportunity, any employment opportunity or career path that may present itself in my future. I am grateful to all of those who work here and work here for this wonderful opportunity. And then we also hear from our preceptors in their evaluation. I'll read the one from the middle. Hosting an intern has been a pleasure and an honor. She is the epitome of what we want in an intern. We hope our next intern is just as great as her because she has really set the bar high. We love hosting UAB students and hope we can continue to do in the future. Thank you for all you do. Thank you for all the great people you bring to our agency and community. So again, this just further highlights what we're doing in our classrooms and how that's translated into the internship, the applied practice experience for our students. So we're looking at public health, our internship impacts, similar to what we've seen before over the years. 97% of the students, this is what I really want to highlight because I do teach in a lot of these courses, 97% of our students are stating that they agree that their coursework has adequately prepared them for their internship process, for their internship experience. And we had most of our 100% of the preceptors agree that their agency benefited from hosting an intern. And I think that's just something that we should applaud as a school, that our courses are preparing our students for these experiences. One thing we also like to think about a pathway to students getting jobs. A lot of times I like to ask students, well, what's next for you? And so when it's really rewarding when we hear students to say that they received a job or an offer at the internship site that they have worked for. So we've had 35 students extend their internship beyond the hours that were required for their APE. We've had 13 students to be offered a full-time job, a full-time position with their interning organization. And we've had 12 of our students to be offered a part-time job. Again, it's very exciting to see this because it lets us know that the organization really believes our students are capable to work at their organization. So this is just to highlight quickly the students that completed their DRPH practicum in this past academic year. We had 5 of our students that were from the Department of Health Policy and Organization, and then we had 4 students from biostats. So keeping with our objective 1, it's important to also highlight, so again, looking at promoting opportunities that enhance public health practice and service experience with students, it's important to note our service learning. We had an increase in our service learning courses where we've now up to 4 service learning courses where we had 40 students enrolled with 15 credit hours that they were responsible for a total of 132 hours of service. And so you can see the list of courses that are there as service learning courses. And I know as a school, we are working to try to get other courses that do service learning registered as a service learning course. So if you teach a course that has some service in there and you want it to become a service learning course, I can find somebody to help you determine how to get that, that notation. And when it comes to experiential learning, we go beyond just the classroom and we have this travel course. And so we have Exploring Population Health that started in, what was the first year? 2018. And so this year, our students are going to the United Kingdom and they're traveling May 9th through 21st. Again, our goal is to provide students with other opportunities to learn about public health. And this is one way that students can engage in public health learning outside of the classroom. And so this course is a mini course that happens. And I think they're preparing for other countries to visit in the next upcoming years. So service experience. So I talked about applied practice, talked about service learning, and then we have service experience. One thing that our office also measures are student organizations, the metrics for student organizations. And so we had 19 events that were community and campus events in 2022 to 2023 with 455 attendees. And then we had 92 education events and that had a total of over 2,000 attendees from the organizations that are within the School of Public Health. Our Public Health Association, PHSA, hosted many events in 2022-2023. One that we would like to note is we traveled to the Birmingham Civil Rights Institute. Along, they had other lunch and learns about organization, coffee hours with professors. They had, when we were thinking about mental health, they had Hand and Paw come for those who needed a break and spending some time with animals. And so there's some of the events there. And then we also want to highlight in terms of service experience as well. We want to highlight the AmeriCorps Statewide Vista program that's led by Dr. Amy Chatham. And so they had a total of 23,000 hours and over 23,000 hours committed to community service in 2022-2023. So I don't know who that woman is, but I think she was here in this room years ago when we had to make a difference above the projector. So we're moving into our second objective. We're promoting and sustaining we want to promote and sustain a level of SOPH faculty practice engagement within the community. So I'll start with our practice engagement faculty. Okay. We now have a total of 6 faculty that are on the practice track. In 2022-2023, we had between the faculty, they had a total of $29 million in direct awards with $10 million indirect for a total of over $39 million. And they had 29 active awards. And this is active awards as principal investigators. And so many of us were on other projects as well. So we wanted to highlight that this just showed the 29 active awards are with them as principal investigators. And I just want to highlight that the courses that they teach. As you will see, a lot of the courses are practice-based courses. And so a lot of the times we're able to share within our classroom some of the work that we're doing and being able to share that with our students in real time. So there are some of the courses that we're teaching. A lot in the core, so PUA 604, 602, 604, 605, and 606. And also other courses within departments and at the undergraduate level as well. So one thing that we like to do is highlight what's happening in the practice community. And one way we can do that is through the public health practitioner affiliate program. So when we have practice members or community members that come in to teach, to speak to our students, to mentor our students, we want to highlight their contributions in a way where they have a 3-year appointment that's renewed every 3 years within the school, and it goes through the faculty affairs. It's on the bylaws of the faculty affairs committee. Our last public health practitioner affiliate was Monique Mullins, and a lot of these are rolling off soon. So for our faculty in here, many of you have community partners and practitioners that come to your classes, that mentor your students, that you connect them with every day. So we encourage you to please nominate them. You see, we want you. I won't call out names, but you all, to nominate the people that are doing great things for your classes. We want to highlight them as a public health practitioner. So you all know about the service survey that goes out, faculty service survey that goes out every year. And this is what we received back from that survey. We had 14 faculty to serve in leadership positions for 25 community and health organizations. And so again, this just further highlights what we do in the school is beyond just this building, and that we are represented in many areas within the community, and which is very exciting to see that. So thank you to all of you that completed that survey. It will be sent out again in August, so we encourage you to complete it then as well. So going into our last objective 3, promote and sustain strong connections between academic programs, community partners, and public health practitioners. And so I will highlight our seminars, networking event, and other activities and initiatives that we've done within the school. So the public health, our office, we have partnered with with practitioners and community partners to host seminars and podcasts and so forth. So you can see who some of our co-sponsors have been over the last academic year. We hosted 17 seminars with over 1,000, almost 1,200 live attendees. And also we've had over 1,000 recorded views. And we've partnered with over 69 community partners. Again, these partners presenting as guest lectures, seminars, are participating in our podcast series and networking events. Student engagement, we'll bring this up again, but with student engagement, one thing that we have done, we've partnered with our local health department, so our state level, Jefferson County, Mobile County, and other organizations to host networking events. Again, our goal is to connect students to the workforce. We're preparing students in the classroom, and we want to be sure that we are preparing them for the workforce. And so a lot of times we try to have these network engagement events for students to be able to meet and talk with our public health workforce. Some of these have been in person, some of these have been virtual. We had one during National Public Health Week. We had a networking event with JCDH, and then we also had with our Alabama Public Health Association, which I'll highlight again later on, where we had a networking expo as well. So again, our goal is to be able to create opportunities for students to meet with their partners, with our partners. So another thing that we do, we have a relationship with the Career Center. In fall of 2022, we didn't have a liaison for the Career Center, but now we do with Davian White, and he's worked very closely with Tessa Graham to be able to plan and host events for career services. In that, we looking at our SOPH engagement with career services, we had over 1,500 students alumni to be enrolled and activated. We've had 164 students to attend the career fair attendance, and we've had 93 students to establish to have appointments at the Career Center. And so again, we're trying to strengthen our relationship with the Career Center. We've had headshots We've had Meet the Career Center with 20 students served. We have interviews, workshops that have been presented with the that was presented with the Career Center. More of, again, this pathway to practice in a sense of engaging students and connecting them with our with public health and connecting them with our partners. One thing that we've had, we continued in 2022, 2023 is the Public Health Influencers Program, where we're bringing in a group of high school students to come in for a week-long intensive to learn more about public health broadly, environmental health, social determinants of health, built environment, and so forth. And so last year we had 27 students to complete that program. I think we have over 30-something applications now, and applications are still open. But we're very excited to think about how can we start engaging students early and getting them interested in public health sooner. So hopefully it'll be a pathway to attending UAB or a program in public health, and then also joining the public health workforce. And that was led by myself, Paulisha Holt, and Mina Navabi. So Mina and I will have it this summer. Additionally, again, trying to get students outside of the classroom and connecting them to opportunities as a co-curricular and in an enhancement to what they're learning. We took students to the Equal Justice, to EJI's Legacy Museum and Memorial for Peace and Justice last year in Montgomery. And so we did the same thing again this past week. We're going to Tuskegee, and we'll probably do this trip again for our students in the fall. So it's National Public Health Week. Welcome. And so last year we hosted, we had events during National Public Health Week. It was April 3rd through 9th, 9th last year. And so we had a public health address by the then health officer, Mark Wilson. And again, we partnered with JCDH for a networking event and the Alabama Public Health Association. One thing I want to talk about of what we really wanted to highlight about that, we were able to bring in all of the health officers last year in collaboration with the Alabama Public Health Association. And the students had an opportunity to ask them questions, and they had some really great questions during that time. And also to see all of the health officers in the state, and to be able to network with organizations or with bureaus within the state health department. So with that being said, I want to invite you tomorrow. We have Exploring the Collective Impact of Public Health in Jefferson County, where we'll have Dr. David Hicks, the health officer of JCDH, coming to speak to us. We'll have remarks from 10 to 11, and then we'll have a networking reception again. So if you have students that are interested in learning more about public health, but also networking with our departments within JCDH, please encourage them to attend. Okay, that'll be tomorrow at 10 o'clock. I hope to see you there. Okay. We also have a Lunch and Learn with Lister Hill. That's going to be on Wednesday from 12 to 1 in this room. So you know where to come. This room from 12 to 1. And then tomorrow, on Thursday, we have a networking house party. Again, the networking. We believe in collaborating and networking in OPHB. So again, another opportunity through this relationship with our Career Center to get students involved and get them connected with people in this area. So I'm going to pause to breathe, but also give you a chance to just review some of our other events that we're having this week. So next I'll talk about workforce development. Again, if we're training students in the classroom, we're giving them an opportunity to experience and practice in the field. We also need to think about the practitioners that are out there working now. And so one of our responsibilities, or one of our missions, is to help build the workforce. And we do this in a number of ways. I would like to highlight some of the projects that we have in the state. So we have the Alabama Regional Center for Infection Prevention and Control. also known as ARC IPC, and the Alabama Nursing and Long-Term Care Facility Strike Team, our long-term care strike team. And so we had a few opportunities for trainings in this past academic year that we want to highlight. We had a total of 86 trainings with over 60,000 contact hours between the months of June and December 2023. Live and recorded views, 48,000. And then we have over 4,000 CEUs provided, nursing CEUs provided. What we wanted to highlight is that the ARC IPC amendment was extended to June 2026, and the long-term care strike team was extended to June 30, 2027. Also, something else to highlight in terms of workforce development are some of the recent trainings. We have a partnership with the Alabama Hospital Association. And so we want to highlight some of the trainings that we had with them, and also hosted 9 regional boot camps, and also hosted a boot camp in August of 2023 with 220 participants, and also infection prevention boot camp for our long-term care strike team. It had 180 participants. Other offices and centers within our school also offer workforce development. And so we wanted to highlight some of the work of them, of those offices and centers as well. So lastly, we're going to talk about the communications initiative, and I'll highlight a little bit more about what we found out in our focus group. So the Get a Handle newsletter is our main form of communication within the Office of Public Health Practice. And if you can see, we have 50 editions, 35% open rate with 6.6% click rate. Again, what we wanted to understand is a little bit more of how effective are we in communicating. And so we had an opportunity to sit with a group of students to understand more about our mechanism of communicating with them. Again, as you all saw, many of them are receiving their internship information, job information through the Get a Handle newsletter, but we wanted to make sure that we were efficient and effective in providing that information. So when meeting with these students, we realized that we need to revamp our Get a Handle newsletter. And some of the things that they highlighted was moving some of, getting to a way where it's more student focused, and it's going to be student specific. And so a lot of information specific to SOPH and student focus will now be in there. And so something that they want our newsletter to highlight are events within the school, not within the university as a priority, jobs and internships, seminars within the school, and also department events. And so we're working strategically to try to develop a new path and plan for how we deliver that information. So what's next? The school is engaging in that strategic planning process. So as the school engages in that process, we will fall in line and review some of our goals and objectives and what we're trying to accomplish as an office. With our Summer Institute, we really want to have more students involved. Right now it's a week, and the capacity that we have for our students, we're seeking additional funding to be able to provide human resources and also the capacity to expand it. So that's something that we are working on as well. And then increased compensation for applied practice experiences. I will highlight that we've been working with other universities across the state and within our networks to understand what's the landscape of compensation around APE, around other institutions similar to us, to determine what are some mechanisms or strategies for us to increase those type of opportunities for our students. And now I am complete with this presentation. I appreciate you all taking time to come and learn more about what we've been doing in the Office of Public Health Practice. Again, I couldn't stand up here if it wasn't for our awesome team. So again, I want to just applaud them for what they have done in this space, and thank you for your continued support.